Which of the following pathophysiological mechanisms is most likely responsible for the clinical findings in this patient? 4-year-old boy brought to pediatrician by his parents due to a persistent cough and frequent respiratory infections. His growth is below fifth percentile for his age. Physical examination reveals digital clubbing, crackles in lower lung fields bilaterally, and rhonchi. Sweat chloride test returns elevated result. Which of the following mechanisms is responsible for clinical findings in this patient? Okay, so it's a young kid, go to a pediatrician for persistent cough and frequent infections. Um, Digital clubbing, so it's like he is not getting enough oxygen, hypoxic, crackles in lower lung fields, bilateral rhonchi, and then it says the sweat chloride test. So I'm thinking cystic fibrosis.
Okay,
Um,
good, good.
and then which of the following pathological? So cystic fibrosis is dealing with um, like it's the defect of the chloride channels, and it causes a overproduction of like mucus, I believe. Yeah, so defective chloride ion transport.
Okay, good. So I loved how you worked through this, right? You figure out a diagnosis, right? You understand kind of where, what is the mechanism of that diagnosis, and you're able to find your answer pretty easily, right? So that's like the mentality of every question that you have to follow, right? So anywhere along that path where you get stuck, right? For instance, like right now, I think the where you're getting stuck on the other questions that we've gone through is mainly the fact that you can walk through the clinical scenario, you're coming up with the diagnosis, but you can't you're missing the mastery of the diagnosis, so you can't find your answer in the answer choices, if that makes sense.
Yeah.
So that's going to be kind of the next level. So this you work through beautifully, right? Pediatric kid, respiratory infections, right? You have digital clubbing because of the hypoxia, things like that, right? Also, you can have pancreatic issues with cystic fibrosis, right? Meconium, things like that. So you got to remember everything about cystic fibrosis, and of course, right, your chloride channel, right? Which I think it's like Delta 508. I could be incorrect though. That's the number I remember, but it's a specific amino acid chain, right? But it deals with the chloride ion transport, right, which is defective, which is why you have cystic fibrosis, right? So definitely for sure, your CFTR gene. Good.